So imagine you go to this really high-end, incredibly sleek medical clinic.
Right, like the really fancy ones.
Yeah, exactly, like the ones with the cucumber water in the waiting room. And you're paying out of pocket for this state-of-the-art, high-tech laser procedure. So you put on the little safety goggles, you hear the machine whir to life, you get that faint, I don't know, that clinical smell of ozone and smoke in the air.
Oh, yeah, very distinctive.
Right. And then after a few sessions, you actually experience real, measurable, undeniable relief from your symptoms. Like you feel completely cured.
Which is amazing, right?
Totally. Only to find out, like months later, that the laser was entirely fake. I mean, the machine made all the right noises, it had the smells, but it never actually treated you at all.
It is, it's the ultimate medical plot twist.
It really is.
Because it completely shatters, our traditional understanding of what it means to actually be healed. We are so conditioned to think of medicine as this strict binary transaction. Like, you take a chemical or you get a procedure, and that external thing just fixes the internal problem.
Right, like a mechanic fixing a car engine.
Exactly. But the human body is just vastly more complicated than that.
Which brings us to the mission for our deep dive today. For you listening, our goal today is to unpack this fascinating biological mystery. Like, why do researchers go to such incredible, sometimes frankly absurd lengths to fake a medical procedure? And what do these meticulously designed shams actually reveal about the hidden power of your own mind and body?
Yeah, it's a wild topic.
It really is. We're looking at a huge stack of clinical trial data, meta-analyses, and some recent FDA warnings covering things like urology, menopause treatments, and sexual dysfunction. We really want to figure out exactly why studies use these sham treatment groups.
Because it's a journey that kind of forces us to look at the placebo effect from a totally new angle. Not as a failure of a drug or a device, but as this active, really potent biological mechanism that we're honestly only just beginning to map out.
Right, right. So, okay, let's lay the groundwork here. You've probably heard of a placebo, right? Like the classic sugar pill.
Yeah.
But a sham takes that concept to a completely different level. We're talking about an inactive procedure.
Yeah, a lot more complex.
Oh, for sure. The doctor literally goes through all the physical, theatrical motions of a medical treatment, like a surgery or a laser session, but without actually performing the intervention.
Right. It's essentially the procedural equivalent of a sugar pill, but just with significantly more stagecraft.
The way I think about it, and anyone who grew up with siblings is going to immediately understand this, a sham treatment is basically it's handing your younger sibling an unplugged video game controller.
Oh, that's a perfect analogy.
Right. Because they think they're playing the game with you.
Yeah.
It's all about the illusion of participation. Like they press the buttons, they lean into the curves on the couch, they really feel like they drive in the car on the screen.
Yeah, and that illusion of participation is actually a vital scientific tool. To really understand why it's so critical, we have to look at this massive shift in the medical world over the last, I'd say the last decade or so.
Yeah, a big shift.
There's just been an absolute explosion of procedural treatments that don't involve taking a pill. Things like lasers, radiofrequency devices, injections. And a few years ago, this really came to a head with a major FDA crackdown on a trend that was being marketed as vaginal rejuvenation.
Yeah, I was reading through the source materials on this, and the scale of this trend was just massive. Like non-medical clinics, sometimes literally just aesthetic spas, were heavily marketing these CO2 lasers.
Oh yeah, they were everywhere.
And they used these incredibly catchy, consumer-friendly names, right? Calling it a designer vagina or a vaginal facelift. And they were claiming that these lasers could treat in everything: pelvic pain, vaginal dryness, even urinary incontinence. And they were largely targeting menopausal women or breast cancer survivors.
Right, and the claims were just vast, and more importantly, they were being made without really rigorous long-term data to back them up. So the FDA eventually had to step in. They issued these really stern warnings about deceptive marketing and potential harm.
Right, because it wasn't proven.
Exactly. Their stance was that the safety and the efficacy for these specific gynecological uses, it just simply hadn't been proven yet. But meanwhile, the clinics were pushing back super aggressively.
Yeah, I bet.
Their argument was essentially like, look at our waiting rooms. We have thousands of satisfied patients who feel dramatically better after they get these laser sessions. So you have this really intense standoff. The FDA is out there demanding hard proof, while the clinics are just pointing to all these happy customers. But, in the scientific community, patient testimonials just aren't enough.
No, not at all.
Because the sheer act of seeking treatment alters your perception of it. So to figure out if these expensive laser clinics were actually curing people, or if it was just, the power of suggestion and the comforting environment of a high-end spa, scientists had to design the ultimate lie detector test.
They had to create a sham laser trial. Because, look, if you just compare women getting a laser treatment to women sitting at home doing nothing, the laser group is always going to report feeling better.
Always.
Always. The act of going to a doctor, being cared for, putting on the gown, trying a cool new technology, all of that feels profoundly good. So to isolate the actual physical effect of the laser itself, researchers have to create a completely fake experience that is indistinguishable from the real thing. Which leads us to the Loven randomized controlled trial. This study looked at 60 women suffering from genitourinary syndrome of menopause, which, just for context, involves some pretty severe dryness and pain.
Yeah, it's very uncomfortable.
So half the women got the real CO2 laser, the other half got the sham. And honestly, reading the methodology on how they pulled off this sham, it's like reading a script for a Hollywood heist.
It really is. It is an exercise in just extreme theatricality. So in the sham group, they use the exact same CO2 laser machine, but they dialed the energy all the way down to this minimal, like 0.5 watts.
Wow, just barely on.
Right, which is low enough to have absolutely no physical ablative effect on human tissue. But the really critical part of the illusion is the sensory experience. The machine is actually designed by the manufacturer to make the exact same zapping noises, regardless of whether it's firing at full power or at 0.5 watts.
That's crazy. And they even left the room's smoke evacuation system running during the sham. So for the patient lying there, it's loud, it sounds highly medical, there's a big machine whirring away, and the air literally smells like a procedure.
Yeah, it feels incredibly real.
But wait, I have to ask. Because even with all that sensory trickery, human beings are terrible liars.
Yeah.
Like, wouldn't the doctor operating the laser know they were giving a fake treatment? Couldn't they accidentally tip off the patient with, I don't know, their body language or their tone of voice?
That is a great point, and that phenomenon is actually known as provider bias. It can completely ruin a trial's data if you aren't careful.
I would imagine so.
But the Loven researchers anticipated that exact thing. So to counter it, they implemented this really extreme double-blinding protocol. The doctor performing the procedure wasn't actually allowed to set up the machine at all. Yeah. A separate nurse came into the room beforehand, programmed the laser to either the real high power setting or the fake 0.5 watt setting, and then they literally placed a physical opaque cover over the machine's screen.
Oh, wow. So they just hit the dial.
Exactly. So when the operator walked into the room, they were just as blind as the patient. They just aimed the probe and pressed the pedal, having absolutely no idea if they were firing a real laser or just a prop.
That is wild. Complete double-blind conditions. So the stage is set perfectly.
Yep, perfectly.
And then, 12 weeks go by, the results come in, and the women in the actual high-powered laser group reported that their most bothersome symptom dropped by 23.6%, which is, a solid, meaningful drop in pain.
Right, a real improvement. But here is the kicker. The women in the sham group, the ones who got the fake 0.5 watt laser, they reported that their symptoms dropped by 13.2%.
Wow.
And when the statisticians ran the numbers, comparing the variance and the sample size, there was no statistically significant difference between the two groups.
So wait, in the eyes of science, the real laser performed no better than the fake one.
Basically, yes. Both groups experienced a tangible benefit, but the laser itself wasn't the deciding factor.
That is just fascinating. And the sources also highlight this other study, the LIGHT trial, which completely reinforces this. That trial looked at breast cancer survivors. And just to give some context for that, these women often take drugs called aromatase inhibitors.
Right, to manage the cancer.
Exactly. Those drugs essentially starve the body of estrogen to prevent the breast cancer from returning. But without estrogen, the vaginal tissue loses all its elasticity and moisture, which causes extreme painful dryness. So in the LIGHT trial, half got the laser, half got the sham. And not only did both groups improve, but the sham group actually tolerated the fake treatment better than the real one.
Which makes sense because the real laser caused slightly more discomfort. I mean, physiologically that's expected since it's actually ablating or literally burning microscopic holes in the tissue.
Yeah, ouch.
Right. But in terms of long-term symptom relief, the fake laser was just as effective as burning the tissue.
So the sham groups essentially vindicated the FDA. The laser itself just wasn't the physical miracle cure it was marketed to be.
No, it wasn't.
But, for anyone listening, this leaves us with this lingering, almost uncomfortable question. If a sham procedure can drop severe pain by 13%, it really begs the question of whether this is all just a psychological trick. Like, are these women just tricking themselves into feeling less pain because they want the treatment to work so badly?
Well, to really test that, we have to look at what happens when the symptom isn't just pain, but complex behavioral dysfunction.
Which means we're pivoting from surgical lasers to daily medications.
Exactly. Because the placebo phenomenon is perhaps even more pronounced when we look at female sexual dysfunction, or FSD.
Right, so FSD covers a whole range of issues. Low desire, arousal disorders, pain during intimacy. And for years, pharmaceutical companies have been chasing this idea of a female Viagra.
Oh yeah, a huge market.
Totally. They've tested drugs like flibanserin and bupropion. And these aren't just simple hormones. They actually target neurotransmitters in the brain, like dopamine and serotonin, to theoretically boost desire and reduce inhibition.
And the data on those trials is just staggering. There was a major meta-analysis conducted by Weinberger and colleagues that looked at 8 randomized controlled trials for these FSD medications. This covered almost 4,000 women.
That's a huge sample size.
Massive. And they used this highly validated questionnaire called the Female Sexual Function Index, or FSFI, to measure the results.
Right, and the numbers on this really stood out to me. The women who took the active, chemically real drugs saw their scores improve by 5.35 points on the index. But the women who took the placebo, literally just the inactive sugar pill, they saw their scores improve by 3.62 points.
Yeah, and when the researchers calculated that out, a staggering 67.7% of the total treatment effect was accounted for by the placebo alone.
Over two-thirds.
Over two-thirds. The active, highly engineered pharmaceutical drugs that were specifically targeting brain chemistry were only minimally superior to the fake pills. Over two-thirds of the perceived cure was derived entirely from the sheer belief that they were taking a cure.
Okay, we really need to put those points into human context. Because an improvement of 5 points on that index, that might mean the difference between dreading intimacy and actually desiring it.
Right, it's a huge lifestyle shift.
It's a life-altering shift. But the sugar pill group improved by nearly 4 points. They achieved almost the exact same shift in their daily lives, their relationships, and their mental health with absolutely zero actual medication.
It is a profound shift, and naturally it leads to a lot of skepticism.
Well, yeah. My immediate thought when I first read that 67% number was social desirability bias. Like, you're in a clinical trial, the doctors are super attentive, you're taking a pill every single day, and when they hand you the clipboard at the end of the month, you just kind of subconsciously trick yourself into checking the I feel better box, just so you don't disappoint the researchers. You want to be a good patient?
Yeah.
I assumed it was just like a paperwork illusion.
And honestly, that's the most common assumption we make about placebos. We assume the patient is just lying on the form to be nice. But there was a 2009 study by a researcher named Bradford that looked specifically at the underlying mechanisms of why women on placebos for sexual dysfunction were reporting such high numbers. And they found that they weren't just checking boxes to be polite.
So if they aren't just lying on the forms, the placebo must have actually changed the way they interacted with their partners outside the clinic, right?
Exactly. It triggered a massive behavioral shift. Because these women believed they were being medically treated, they felt this sudden influx of hope and a really massive reduction in performance anxiety.
Oh, that makes sense.
Yeah, that psychological permission basically gave them the confidence to initiate intimacy more often. The study actually showed they reported a significantly increased frequency of satisfying sexual encounters during the trial.
So it creates a self-fulfilling feedback loop.
Precisely.
The sugar pill obviously didn't chemically alter their dopamine levels to increase libido, but the belief in the sugar pill completely altered their mindset. They acted more confident, they engaged with their partners more openly, and that real-world behavioral change is what naturally improved their symptoms. The placebo was essentially just the psychological key that unlocked a real behavioral cure.
Yeah, it really highlights how intertwined our psychology and our physical behavior really are. When the mind genuinely believes a safety net is in place, the behavior naturally follows.
That makes complete sense to me. Like, you think you're cured, so you act cured, and acting cured actually cures you. It's the ultimate fake-it-till-you-make-it mechanism.
It really is.
But, okay, I have a major hurdle with this concept when we try to apply it to other conditions. Like, I can totally understand how a sugar pill can give you the psychological confidence to change behavior like having more sex. But according to our sources, researchers are also using sham treatments and placebos for overactive bladder syndrome, or OAB,
Oh, yes, and OAB is a fascinating frontier for this exact reason.
because an overactive bladder is when the bladder muscle spasms involuntarily. It causes these sudden, intense urges and urinary incontinence. A spasming bladder isn't a behavior you can just confidently change with a positive mindset.
Right, it's not like initiating intimacy.
Exactly. It's an involuntary muscle spasm. I can't just positive think my heart into beating slower or positive think my stomach into digesting food differently. So how does a fake pill or a sham procedure physically stop a bladder from leaking?
And this is where we cross the line from psychological feedback loops into tangible, measurable physiological changes. Your brain actually has far more direct control over your local anatomy than we usually give it credit for.
Really?
Yeah, let's look at the OAB data. There was a meta-analysis of Japanese clinical trials by Hara, and they found that patients on placebos saw statistically significant drops in daily incontinence and urination episodes.
Okay. Wow.
And incredibly, this placebo effect didn't just happen on day one. It got progressively stronger over time, peaking at about 8 weeks into the trial.
Wait, so for 2 straight months, simply taking a sugar pill progressively reduced the number of times these patients leaked urine?
Yep. And another review by Manjura confirmed the exact same trajectory. Significant improvements in incontinence episodes, the frequency of micturition, and even the sheer volume of urine they could physically hold in their bladders before needing to go.
That is wild.
It is, and the scientific community was faced with the exact dilemma you just brought up. Is the placebo just suppressing the conscious urge in the brain, like making them ignore the feeling? Or is it actually changing the local physical anatomy of the bladder?
But to answer that, you'd have to somehow measure the physical mechanics of the bladder while someone is taking a placebo.
Right, and you do that using urodynamic studies. You literally insert catheters and measure the pressure inside the bladder and the urethra.
Okay, sounds intense.
It is, but a study by Panay did exactly this, and it is arguably one of the most mind-blowing pieces of research in our stack today. They really wanted to isolate the physical mechanism of the placebo effect in overactive bladder.
So they measured the internal bladder pressure of people who are only taking sugar pills.
Exactly. Specifically, they looked at the detrusor muscle. That's the smooth muscle in the bladder wall that contracts to push urine out. They also measured the opening detrusor pressure, which is an indirect measure of how hard the pelvic floor and the urethral sphincter are working to keep the urine inside.
Oh, so it's measuring the body's physical resistance to the leak.
Spot on. And the researchers stratified the patients based on their results. So they took the people who responded really well to the placebo-like, the ones who stopped leaking almost entirely, and they compared their internal mechanics to the people who didn't respond to the placebo.
And what was the physical difference?
The patients who responded well to placebos had significantly increased opening detrusor pressures.
Wait, so the placebo didn't just chill them out mentally so they didn't mind the urge as much? It physically changed the pressure of their muscles.
Yes, the placebo effect wasn't just a central mental suppression thing. It manifested as a locally derived physical mechanism. Without even consciously realizing it, the patients who believed they were taking a real drug literally strengthened their pelvic floor and increased their urethral outlet resistance.
But how does a belief in a pill actually send a signal to a smooth muscle to increase pressure? Like there has to be a biological pathway for that.
There is, and it all comes down to the autonomic nervous system, which operates completely below our conscious radar. So think of your brain as the CEO of a massive corporation, right? And your nervous system and immune system are the factory workers.
Okay, tracking with you.
When a person is suffering from chronic pain or a chronic condition like OAB, the CEO is just in a constant state of panic. The body is locked in a fight-or-flight sympathetic stress response.
The alarm bells are basically always ringing.
Exactly. But when that patient enters a clinical trial, they are suddenly surrounded by attentive doctors. They are given a treatment. The sham treatment acts like an official memo sent directly to the CEO saying, hey, help has arrived. The company is safe.
Oh, I see.
So the CEO stops panicking. The brain shifts the autonomic nervous system out of that stress state and into the parasympathetic rest and digest state.
And that neurological shift changes the subconscious signals being sent down the spinal cord directly to the smooth muscles in the bladder.
Exactly. Just by participating in a study, keeping a urinary diary, and genuinely believing they were being helped, their autonomic nervous system prompted their pelvic floor musculature to change its mechanical behavior. The workers on the factory floor went back to regular maintenance and repair just because the boss told them everything was going to be fine.
Wow. That completely reframes how we should look at clinical trials. I mean, when you see a news headline that says a new medical device or a new drug failed to beat the placebo, the immediate reaction is to just dismiss the whole thing as a failure. Like, we think it means nothing happened.
And that's the biggest misconception. Those sham treatment groups aren't just there to frustrate pharmaceutical companies or to prove that a device is useless. They are essential tools for isolating the incredible inherent healing power of the patient. Healing is not a one-way street where a doctor applies a tool to a passive machine.
It's a collaboration.
It's a highly complex dynamic mix. It's a combination of the active medical intervention, the behavioral changes the patient makes when they finally feel supported, and the body's actual physiological adaptation to the sheer belief that it is being healed.
I mean, we've gone from unplugged video game controllers to high-tech lasers that don't actually burn anything, to literal sugar pills that physically tighten pelvic floor muscles. The sham isn't just a trick to catch a bad drug. It's a mirror showing us what the human body is capable of executing entirely on its own, just when the brain gives it the green light.
Yeah, it shifts the entire paradigm of how we view healthcare. The ritual of medicine like putting on the white coat, the high-tech sounds of the laser machine, the daily routine of swallowing a pill, that ritual is a powerful therapeutic intervention in itself.
Which really leaves you, the listener, with a truly provocative final thought to mull over today. Because we've seen that a sham treatment or a placebo can account for nearly 68% of a cure in complex behavioral conditions. We've seen that it can literally alter your internal bladder pressure or even eliminate severe menopausal pain just as effectively as a tissue-burning laser.
It creates a fascinating practical dilemma for the future of medicine, honestly.
Right. If a sham laser works almost as well as a real one, but with absolutely zero risk of tissue damage, burns, or scarring, you have to wonder, should doctors start prescribing placebos intentionally? If the illusion of treatment triggers your own autonomic nervous system to cure itself without the side effects of heavy pharmaceuticals or invasive surgery, maybe the fake treatment is actually the most advanced effective medicine we have. So the next time you go into a clinic and hear the whir of a machine, you really have to ask yourself, is the machine healing you, or is the machine just giving your body permission to heal itself?